Hello, everyone, and welcome to another episode of Innovation Saves Lives. Today, you have your host, Leonard Kim, and with us today is Donna White. Donna White's part of the BHRT Training Academy, and what we're going to do today is discuss a lot of different things in regard to like hormone health and so forth. But before we get into anything, would you like to explain a little bit about what BHRT is, what the Training Academy is, and how you kind of got involved in the industry?
I would be happy to, Leonard, and I think that I'm looking forward to this episode because I really want to share some things that would help your audience understand hormones and how hormones really do support innovation. They're innovative as well. So let's talk through that. So hormones. Okay, we all have them, male, female. We need hormones to live and sustain life. Think about thyroid, insulin, and then there's the sex hormones, estrogen, progesterone, and testosterone. Our human body has to have hormones. But problems start happening when hormone levels fluctuate or drop. So when would that be? That would be right before a woman's period or throughout her menstrual cycle, or as women enter perimenopause or menopause, or even younger women with PMS. And for men, women aren't the only ones that have hormone issues. 1 in 4 men over 40 has low testosterone. So this is universal, affects us all. So when it comes to hormones, it's very confusing. Just think about things that you might have heard. Oh, hormones cause cancer. Hormones cause heart disease. All of these myths, which are not backed by research and data. So that's why I think these conversations are so important to explain the effects of hormones. And okay, so let's say, you're sitting there listening and you're like, oh, I don't have PMS. I'm not in menopause. I'm a man. Oh, my libido is fine. I'm sure my testosterone is good. Maybe not. So I can tell you, here's some signs that you might be low in hormones or your hormones might be out of balance, because sometimes they can be too high. So let's think about how many people listening are struggling with fatigue, whether it's all day just tired or maybe the afternoon fatigue. What about sleep issues? Can't get to sleep? Just put your head on the pillow and your mind starts racing. All those things you could have done, should have done, still have to do, can't forget to do. So there's sleep issues. Or going to sleep fine and waking up at 3 o'clock, 4 o'clock, 5 o'clock, can't get back to sleep. So we got fatigue, sleep, weight gain. Okay, most women gain 20 pounds at menopause. Doesn't have to be that way. Hormones impact our metabolism and whether we're storing fat or burning fat. So we got sleep, we got fatigue, we got weight, we have mood issues like anxiety, depression, mood swings. And then there's cognitive dysfunction, like can't remember what in the heck you went to the pantry for, or what did I just read? Let me read that again. So we got cognitive function, totally impacted by our hormone levels. And then, yes, of course, andropause, low T symptoms like lower stamina, less ability to build and maintain muscle mass, and reduced morning erections. There's quite a few signs of low testosterone for men, and yes, women with PMS or menopausal symptoms, that's the hot flashes and vaginal dryness and all of those issues, unfortunately, many women do deal with. And then there's wrinkles. People with low hormones wrinkle faster. Women with low estrogen look older than women with normal levels of estrogen. So just think about those, and low libido, okay, low sex drive. So just think about those symptoms. And even aches and pains. How many people are affected by those symptoms? And here's the frustrating thing. A lot of times they don't even realize that there could be a hormone imbalance affecting them or triggering those symptoms. So let's say, okay, I had 2, 3, or 4 of those symptoms.
Yeah.
Of course you need your hormones tested, but you don't have to use synthetic hormones. You brought it up as in your introduction. You can use the bioidentical hormones. What are those? Well, bioidentical hormones have the same exact molecular structure of the hormones that our bodies make. They're exactly the same. So they work in the cells just like the hormones that we make. We don't have to use animal-derived hormones or synthetic hormones that cause side effects. We can use bioidentical hormones, and that's what BHRT is using the bioidentical forms of the hormones, which have been demonstrated in medical literature to be much safer, and you're just putting back what your body might be low in or helping bring down your body might be too high in. Maybe you have too much stress hormone. I've been guilty of that.
Yeah.
So it's all about getting our hormones into balance.
Yeah, I think it's kind of interesting what you talk about when you talk about stress, having trouble sleeping, having trouble waking up, or waking up way too early. This is a very common problem that a lot of people are facing, and a lot of people might be thinking, okay, what's causing me to not wake up on time? What's causing me to sleep in? What's causing me to not be able to rest at all? What's causing me to get cause this weight gain? And a lot of people go to diet and other factors, and I don't think hormones are the first things that people think about when any of these things happen. And maybe it should start being one of the first things people are considering. You kind of talked about a lot of the telltale signs of hormones. What do you think would get people into starting to think that hormones is even one of the factors that's causing all of this? Because we have so much information out there.
What you're doing right now, you are spreading the word about a lot of different, opportunities that we have. But yes, getting the word out and addressing some of the confusing myths. So yes, making people aware that some of these things absolutely can be caused by hormones or hormone imbalance, but proper testing, getting our medical providers trained in, because I love influencers. I try to be an influencer, but I need to get my doctor, we need our medical providers trained so that they can thoroughly check our, what the problem is. So let's go back to your example. You said, okay, so what if I can't sleep good? Well, maybe you're making too much cortisol. Could be the cause. So your cortisol is, we call it the stress hormone, but it helps you be alert and thinking clearly and energetic. It's supposed to be high in the morning, but if it's high at night, that's not the right time. Or the sleeping problem could be from low estrogen, or it could be from maybe your blood sugars dropping and then spiking from a glass of wine you had before bed. So it really takes an innovative, comprehensive look at each person's hormones and helping figure out what the problem is.
That makes a lot of sense. And I think when most people do think of hormones, they might think of testosterone and estrogen. But you mentioned like cortisol and other things. Like, I don't think people even consider that these are hormonal factors in regards to their health as well. So when you're going out there and you're looking at someone holistically and looking at all their different hormones and everything, how are you exactly examining that process to figure out if someone has issues somewhere in their hormonal imbalance, or if there's a hormonal imbalance somewhere?
That is such a great question. So it starts with seeing a provider and going through a thorough analysis of symptoms. I mean, I mentioned, 6 or 7 of them. There's many, many more. So you look at, it's not just about labs, but the lab testing is important. It confirms what you're suspecting. Now, I love the whole innovation thing that you have. So an innovative look at lab work, what that means is providers that are certified and trained properly in getting hormones back into balance, they're looking at the lab ranges from an optimal versus normal levels. So they're looking deeper. So maybe your testosterone, it falls within what the lab says is okay, but maybe it's on the very, you just barely made the bottom of the range. Well, who wants to scrape along with barely enough to say you made it? I want optimal levels. I want to feel good. And so that's one approach, is making sure we look at all of the hormones, just like you said, stress hormones, sex hormones, insulin, thyroid, and looking at them through that lens of, optimal versus normal. And then looking at the symptoms. If you look at all the symptoms, your labs should explain it. And it's more than just giving a hormone. Sometimes this comprehensive, innovative approach is, okay, we got to stop that glass of wine every night because it's keeping you awake, or we need to, reduce carbs and eat more, more protein every 3 or 4 hours, keep blood sugar stable, or, so it's lifestyle and dietary changes. It's a comprehensive approach that I believe in.
That makes a lot of sense. And I think when a lot of people go to see a regular physician, a physician assistant, or whatever it may be, they're usually told what the normal range is. And then they're sitting there thinking, okay, I'm within the normal range. Even if you're on the low end, they're just telling you that you're in the normal range. So you think that you're healthy, but you might leave the doctor office feeling lethargic, maybe not waking up on time, maybe even being a little overweight. And you might not know what's going on because your doctor told you what's going on is normal. So from the consumer side, there's the healthcare practitioner that studies hormones and knows about it, and there's one that doesn't. How are these consumers really supposed to know the difference? I know for a physician or someone in the medical field to go out there and train for this, you could go out there and approach people and help them better. But how's the regular person supposed to determine which type of physician they're seeing?
Yeah, and I love what you brought up. You're told you're normal, fine. Here's an antidepressant, or if it's the weight issue, oh, you just eat too much, cut back. That's how discouraging is that? You showed up because you felt bad, or you're trying to get some answers.
Yeah.
So unfortunately, our medical community is not trained in hormone replacement or bioidentical hormone replacement, of getting hormones into balance. It's just not taught in medical school.
Yeah.
So for providers to learn it, they have to step out of their box and go learn it from like our academy or other places that really teach this. So how does the average person know? Well, we do list providers on our website at the BHRT Training Academy, providers that have been certified. But, well, the sad news is most of the experts that are trained really well and have sought out certification are cash practices, because insurance just doesn't, you've probably had shows about, our problems with insurance. Insurance doesn't cover an office visit with a medical provider that lasts, 45 minutes to an hour, where they're really talking to you about your history and your symptoms and, what your health goals are. Maybe you're, forgetful, but if you don't stop having hot flashes, you're going to kill somebody. So it's done through mostly through cash practices. So at least that's the way it is in our country right now. I'd love to see that change, because you know what it's like when you go use your insurance to go to your family practice or internal medicine doc or whatever. How long do you get with them? Are you lucky to get 10 minutes?
I'd say if you think about it, you're there for about 45 minutes, but 30 minutes you're waiting at the front desk, 10 minutes you're waiting for the doctor to come into the office, and maybe you get 2 to 5 minutes with them.
Yeah. That's probably more accurate.
Yeah.
So when you're looking for somebody, just for hormone analysis, testing, whatever, just be aware, okay, this is probably going to be out of pocket, but it's an investment that's really important. I don't see patients, so it's not for me. I'm just trying to help educate, the audience here. And if we think about hormones, okay, so I just said investing in your health. If you leave hormones low, okay, now this is from medical research, published journals. If you leave your hormones low, you're at a higher risk for heart disease. But if you replace hormones, you have a 52% less risk of heart disease. If you just leave your hormones low, you have an increased risk of bone loss and osteoporosis. Well, hormones reduce that risk. If you leave hormones low, you have a greater risk of cognitive decline and dementia and Alzheimer's. Whereas like estrogen, for example, has been shown to reduce that risk 52%.
Oh, wow.
So I just said heart disease, bone loss, cognitive decline, increased risk of diabetes if you just ignore your hormones, but hormone therapy reduces the risk of diabetes. And mood issues. You're more likely to have anxiety, depression, or mood swings if your hormones are out of balance. But the medical literature shows hormone therapy improves mood issues. And then, yes, there's sleep, weight, sexual health, skin health. And listen to all of those are signs of low hormones, which could be prevented by using hormones. It's in the research. It's all there. And listen to this. People on hormones live longer. Male studies and female studies. I mean, who doesn't want those benefits and that type of protection? Yeah, we have symptoms, and women have hot flashes and men have their symptoms, but just those ones that I just named right there could help, us age better, healthier, and have a better quality of life.
Yeah, I think it's really interesting what you say. A lot of the benefits that you point out, like having better heart health, not getting dementia, and lower risk for that. Like a lot of people, when they see a problem occur in their body, whether it's increased weight or maybe muscle loss or so forth, what might they do? They might go to the grocery store and buy some milk. They might go and eat some cheese. They might go and eat some protein. They might explore online to see what type of creative things are out there that they could go out there and incorporate. But a lot of people on this journey don't really stumble. I mean, maybe some people stumble upon like hormone health and everything, but it's not like a common occurrence where people are stumbling upon hormones to really go out there and bring that back to play. And I think this kind of brings us to the future of hormonal health. I know you wrote a book called The Hormone Makeover, and you talked about BHRP and how it's all developing and so forth. If this is the way and it's creating these types of results, we could be in a pivotal moment for more education like this to occur and for the results that you were speaking about. Can you kind of talk more about that a bit?
Well, you are so right. We are at a change in this because the information is there, and because it's not common conversation, like you said, but that is changing. Hormone replacement therapy is one of the hottest searches on Google right now. But the problem was, Leonard, that one study back in the early 2000s, it was used on synthetic hormones and animal-derived hormones. It was back in 2001, and it increased breast cancer and heart disease.
Oh, no.
Those weren't the bioidentical hormones. So it kind of threw our education back 20 years because it was highly publicized. But there's so many other studies showing that even the authors of that study 18 years later came out and said, wait, we made a mistake. Actually, the estrogen reduced risk of breast cancer by 23%.
Oh, wow.
Women on hormones, if they got breast cancer, 44% less risk of dying from it. So we're kind of in the cleanup phase of really pushing and educating medical providers as well as the public that no, hormones aren't something to be afraid of. There's something to be implemented because there's so much research, Leonard, so much research on the positive benefits of using bioidentical forms of hormones. So much so that even medical societies like Menopause Society, the Endocrine Society, and some of these medical communities have now changed their stance. So we're going to see some changes, and we're going to see some changes. Then you've got people like Oprah and Halle Berry and some of these people that are also trying to bring this to the forefront of information and awareness, trying to get, Melinda Gates, what she donated, was it $1 billion to research, women's healthcare research. So it's changing. Yeah. It's been slow, but it's coming.
That makes sense. It does take a long time for things to kind of move in the healthcare system. It's a very slow system. and things don't really move as quickly as they do in other places like tech or innovation. It's a little behind in regards to how fast things move. But hey, I mean, things are moving in the right direction, it seems. And we also have a lot of clinicians and people in the healthcare industry who do listen to this podcast as well. And they might be listening to this thinking that this is something that they might want to go out there and learn and be able to teach, be able to provide. What kind of technology and training do you have behind the BRT training system?
We do. We couldn't make it without it. So our training certification program is all digital. It's online. I mean, we do have some regional symposiums and a yearly symposium at sea, but our training, our exams, our board exam, everything is delivered digitally. And yes, we do use a lot of AI. I mean, why wouldn't we?
Yeah.
For to gather our supporting research, to verify research. We use tech tools for our certification exam delivery. So if we didn't have technology, we'd be back in old college days, I think. So I'm very thankful for being able to connect. Like, our providers watch a significant portion of their training online, but we have live training sessions once a week with the faculty. So we couldn't deliver the experience that we deliver without technology and AI.
Nice. And I'm assuming that if someone's a medical professional, they would get like CME credits and so forth that would go towards their yearly.
Yes.
Awesome.
Mm-hmm. Absolutely.
So when we're kind of thinking about the clinical impact of everything, you have patients coming in, they're seeing the clinicians, they're going through the hormonal process, they're doing the discovery, they're figuring out where the shortcomings are or if there's too much of something going on. They're going through new routines, they're creating new methodologies for their diet, for their lifestyle, with their hormones, and supplementing them as well. When you look at all that, what are the real world results like? How soon are patients seeing recovery? Are people getting less tired? Are they getting their sleep back? Are they losing weight? What do we kind of see in the real world from all of this that's kind of occurring?
And I love that summary you just gave of how it all worked. You got it all figured out. So once you take a deep dive into all of the labs and symptoms and maybe even underlying factors. So let's say a patient is started on, well, let's just say a man. Okay, he's 60 years old, and by the time you reach 60, men, your testosterone production typically is only 40% of what it was back in your 20s in college days. And let's say you're tired, you just don't have that drive, to get out there and be that innovator and to, build your business or whatever. So you're a little tired, working out at the gym, but not really seeing the results. And let's say your provider runs a free and total testosterone. He's looking at some other things like whether or not the man is making too much estrogen, because that does happen, too much estrogen. That's when, can I say man boobs on our podcast?
Yeah, I guess so.
When men start having, I just did. Sorry. So these symptoms, and then you find out, well, yeah, your testosterone level, you're not way down, but it's only 400. Well, most men are symptomatic at less than 500. So the provider says, okay, you don't want to have kids anymore. You're 60, whatever. So we're going to give you a little testosterone. When you replace a lower level of hormones and get it back up to the optimal level, we're not talking about excessive levels. We're just talking about the upper end of normal. It's life-changing because they feel better. They get their energy back. And think of what a confidence boost that is for, a man if he's having a little ED going on or something. It's life-changing when you help a patient sleep better, or stop yelling at their kids every 28 days, or or miserable with hot flashes, or finally able to lose the weight, because doing all of the right things and not losing weight, like you said earlier, that's something we should be considering. Is hormones, are hormones the cause? Because every single hormone, if it is high or low, will affect your metabolism. And here people are working so hard to lose weight. Even people that are taking the GLP-1 medications, a study found that they lose more weight if they're on hormone replacement. So when you help somebody sleep better, get a handle on their mood if that's their issue, get their energy back, it affects their productivity, their relationships, their mental outlook, how they feel, their confidence. Hormones affect everything. And I'm not trying to say that, they're the only thing that, our human machine, our human body needs, but they're critically important.
Yeah. I can definitely see how critically important it is for hormones to really go out there and help someone recover and really get their life back. And it's pretty enlightening to kind of see all that. You mentioned like a 60-year-old going out there and getting their libido back and everything, and you mentioned some other examples. Are there any specific stories of people that you've kind of came across where there were some developments like that really changed one specific person's life?
Well, it's been a long time since I worked in practices, because I've been, the head of the training academy. But I can tell you what we hear repeatedly, and our providers here is, "You changed my life. Yeah. My husband thanks you. My kids, thank you." And then think about it too, Leonard, from a provider's perspective. Some docs can be so overworked. How many patients a day are they trying to see? 30, 40? I mean, they're getting pressure, from the managed care to see so many patients. But as a medical provider, and you get to affect somebody's life like that, kind of brings back the joy. That's what we hear, the joy. This is what I went to med school for. This is what I, had in my mind, that I would be helping people. So, because you see it. Like, for example, Leonard, if I don't take my fish oil, I don't feel it. Yeah. But if I don't take my estrogen, somebody's going to know.
Yeah. I can see
somebody's going to know.
Yeah, I mean, I can't tell if I take my fish oil or not, and I'm not really sure what it does if I do or don't take it, so I can definitely see that. And I know what you mean when you kind of talk about a lot of people feeling like they went to school for something and they didn't really get exactly what they thought they would get at the end. And I think it happens more so in the medical industry than other places, just because they think they're going to go out there and save lives. Next thing you know, they're working 80, 90, 100 hours a week. They may get paid well, they may not get paid well. It's all variable. Insurance is a huge factor on how people are getting paid. And it can be extremely frustrating, especially if you think, let's say you're altruistic and you get into the industry. And then next thing you know, you're only spending about 5 minutes per patient. And you're talking to 30 to 40 people a day. Are you really making the impact that you thought you could? So, I mean, when you think about all that kind of together, some clinicians might think, maybe I should go out there and learn more about BHRT and the Training Academy and learn more about this. How would they go about finding that?
Just see our website, which is BHRTtrainingacademy.com. By the way, there's a free ebook on there called The Bioidentical Hormone Revolution. Please download it, have at it. I wrote that to dispel some of these myths associated with hormones, and for practitioners and the public to really see what the research says about hormones and the importance. Because the biggest thing that I run into is still people and medical doctors still telling their patients that hormones cause breast cancer. We're right in the middle of Breast Cancer Awareness Month. No, hormones do not increase the risk of breast cancer. what the research says, that they are protective.
Hmm.
Testosterone is protective against breast cancer, so is progesterone, and so is estrogen. So that is a myth. And hormones do not cause heart disease in men or women, not according to published studies. They prevent it. So there's just, unfortunately, Leonard, there's a lot of confusion that's still going on out there. So I appreciate your letting me discuss this for your audience.
Well, I mean, there's a lot of confusion in medicine and health in general. Everything from COVID, you have two very diverse sides talking about vaccines. You have two very diverse sides talking about most anything really when it comes to health, from vaccines, whatever it may be. And I think it's up to each individual person to go and uncover exactly what information is out there and kind of make their own decisions. So if anyone wants to go out there and look into that information, you said that was the BHRT Training Academy.com, correct?
Correct.
Awesome.
And then the book is The Hormone Makeover. That's really written specifically for women. It's on Amazon.
Awesome. Well, is there any final words that you wanted to leave with our audience after sharing all of this exciting hormone news with everyone?
Well, you brought up something else. You're a great host, Leonard. You brought up something else, which I didn't answer real clearly. You said, how long does it take to start feeling better?
Yeah.
It can range, but sometimes it's in, like, let's say a lady's real low in estrogen and she can't sleep and, she's got miserable hot flashes. It can be within 2 weeks, but by 3 months, your provider would be rechecking your labs, checking on your symptoms. So somewhere around 3 months, 4 months. It doesn't take a year to get your hormones in balance, but a good 3 to 6 months, you should be very close to where you want to be and enjoying the symptom control, but also the peace of mind knowing you're protecting your long-term health as well.
Yeah, that's pretty amazing for the time frame. If you work out for 2 weeks, if you fast for 2 weeks, you don't really see that much of an impact. But if you're able to kind of get that with hormonal therapy that quickly, that could be pretty cool. And in 3 months, if a lot of people are actually seeing those results, that could be pretty good as well. Donna, I wanted to thank you so much for joining us for the Innovation Saves Lives podcast and sharing all this information about hormones with everyone else so they can learn more about them. For our guests, thank you so much for joining us for another episode of Innovation Saves Lives, and we'll see you next time.
Thank you.